It also regulates certain nutrients and many more. So about the common liver diseases we are going to talk about, I know most of you have heard about fatty liver disease, you've heard about viral hepatitis, alcoholic liver disease, and then liver cirrhosis. But for the purpose of this presentation, we are going to talk more about the common ones that are in our society. And as you can see in the picture, you can see we have a healthy liver here, as you can see, which is the brown color. So as the liver goes through like stages of liver damage, I'm sure you've heard of fatty liver. So there's accumulation of fats in the liver. There's a buildup of fat in the liver. So the liver attains this yellowish color and it looks more greasy. As the process of the fatty liver continues for a very long time, for years, the liver finally loses its healthy tissue. It now gains a tissue called a fibrotic tissue. So there's fibrosis happening. So the liver eventually, with time, gets hardened. And it attains this particular appearance, the fibrosis picture. As the fibrosis also goes on for long, the healthy liver of the healthy tissue of the liver eventually disappears and is replaced completely by the fibrotic tissue. The liver becomes very hardened, it loses its architecture, and it's now progresses to a stage that we call cirrhosis. And if your liver is cirrhotic and it's prolongs or goes on for a very long time, it eventually leads to a cancer because the architecture of the liver is lost and you are prone to developing a cancer, which is like the end stage. And eventually you'll be having complications from this chronic liver disease. You would have a lot of symptoms and eventually the outcome is not great. The prognosis is very poor unless you seek for liver transplant. So the question is, what is liver disease or what is fatty liver? So fatty liver, as maybe sometimes you guys come to our hospital at Sakumono community, you do an abdominal ultrasound, and on the ultrasound, the doctor tells you you have a fatty liver, or sometimes you see on the ultrasound that they've written hepatic steatosis. This simply means that there's a buildup of excessive amounts of fat in the liver. So the healthy liver tissue becomes replaced by these unhealthy fats. Hence, there's less healthy liver tissue in the liver. As a result, the liver, sometimes when there's buildup of this unhealthy fats in the liver, it makes the liver like swollen or enlarged. And you can see when you do the ultrasounds, they'll tell you hepatomegaly, or you'll be told, the doctor will tell you your liver looks enlarged. Most of the time, it's as a result of the accumulation of buildup of these unhealthy fats. It gives it a greasy, yellowish appearance, which I in your slide. So when fatty liver develops in someone who drinks a lot of alcohol, it is known as alcoholic fatty liver disease, which I'm sure some of you have come into the know of it. So there are some people who consume alcohol on a regular basis. Because the liver is responsible for performing so many functions, as in detoxifying waste substances, bringing out waste substances from the body. If you are someone who consumes a lot of alcohol, it could harm the liver. Plus, there could also be an accumulation of fat in the liver, which could even like worsen the situation. For fatty liver, it can also occur in people who don't drink. So you say, oh, I don't drink, but why is it that I'm having fatty liver? So it's not also gotten only in people who drink alcohol. It's also gotten in people who don't drink alcohol because of certain lifestyle habits that people have. But has fatty liver disease. The fatty liver disease, we have stages based on the ultrasound that's done. So what are the causes of fatty liver disease? So as I mentioned, even though if you don't drink alcohol, the likelihood of you getting it is high. Drinking alcohol worsens or causes fatty liver disease. The reason being that when you take in like heavy alcohol, or when you're someone who is an habitual alcoholic, certain metabolic processes in the liver are impaired. So as a result of there's some of the metabolic products that are supposed to be produced combine with fatty acids, and this leads to formation of certain types of fats, which will be deposited on the liver and which will come out as a fatty liver disease. Also, obesity. If you have too much like fat, there will be accumulation of fat in the body. There will be some accumulation also in the liver, which will lead to a fatty liver disease. Also, genetics play a role. Even though the etiology is not really known, the fact that there's someone in your family who has had a fatty liver disease or has been obese or has high cholesterol levels, there's a tendency that you might also end up having fatty liver disease. But with lifestyle modifications, you can change the narrative. Also, as I mentioned, high cholesterol levels in the blood can lead to fatty liver disease. Of course, cholesterol should not be high in our blood. It should just be just the right amount in our body. So once there's a buildup of cholesterol levels in our body, it eventually gets deposited in the liver, and this can also lead to a fatty liver disease. Also, there are certain medications that people are on. So I mentioned an example, tamoxifen. So this drug is mostly used for the treatment of breast cancer. So some of the side effects of it would also cause a fatty liver disease. So the question is, how is fatty liver treated, and is it reversible? So there are currently no medications that have been approved to treat fatty liver disease. So you see, you come to the hospital, you do the ultrasound, the doctor will tell you, based on the ultrasound, you have fatty liver disease, maybe grade 1. Then you ask the doctor, is there any medication that I can take to help my liver or to help me prevent this from happening? The question is, there isn't any medication that has been approved to treat fatty liver. It's solely lifestyle modification. So you basically have to do things that will help the liver not progress to the fibrotic stage and eventually liver cirrhosis, eventually chronic liver disease. So you just have to be modifying your lifestyle habits. And that would help to reverse most of the stages of fatty liver disease. So lifestyle modification is definitely regarded as the first line treatment. And as I mentioned, the causes. Based on the causes, you'll be able to modify them to be able to like treat fatty liver. So you have to limit or avoid alcohol. If you're someone who is a habitual drinker, you drink a lot of alcohol, let's say more than 15 bottles a week or even less, you have to limit it or avoid it. Maybe if you're someone who drinks every day, you can make it once a week, because sometimes stopping is very difficult. Also, you need to take steps to lose weight. So you engage yourself in certain minimal exercises. Maybe taking, instead of like you have a shop closer to your house, instead of taking your car and driving to the place, you could literally walk to the place. Instead of staying in bed if you're on your off day throughout the day, or staying at home and not performing any physical activity, you can go for a brisk walk, or you can even go for a slight jogging. So it shouldn't be any vigorous exercise, but you shouldn't also live a sedentary lifestyle. Also, making changes to your diet is very important. So instead of taking in a lot of these junk foods like the pizza, the fries, a lot of oily or saturated fats, which are not really good, you can take the unsaturated fats. You can also limit the consumption of oily foods. And then you incorporate more of the fruits, the vegetables into your diet, a lot of whole grains, which are obviously also very good for the body. And then you maintain normal cholesterol.
Hello, Doc. Please speak. Can't hear you. You're muted. Kindly unmute
Can you
yourself.
please can you please hear me now? So
Yes,
please, at
please.
what point in time did you lose me?
Before the next slide.
Okay, before. So we go back. So I was talking about the medications. I spoke about when you're being given any medication, whether the normal orthodox medications, herbal medications, you have to really know what the medications do. You need to read about the contents of the medication, whether they are hepatotoxic, whether they affect the liver in any way. And I was also saying that nowadays there are lots of herbal medications in our system. I'm not saying herbal medications are bad. There are very good ones in the system. But before you take in any herbal medication, you need to be in the know of what the herbal medication does and what ingredients are in it. Because there are some herbal drugs that are toxic to the liver, and you might end up taking them for a very long time, which will eventually harm the liver. So before you take in any medication, you need to read about it. Before you take in any supplements, you need to read about them. Also, with viral hepatitis, I'm sure most of us have heard about hepatitis B, hepatitis C, hepatitis. What really is hepatitis? So it's just inflammation of the liver. There are actually various causes of hepatitis. It could be an autoimmune cause. It could be a viral cause. It could be due to drugs. So we have drug-induced hepatitis. It could be due to other organs that are affected, that could even affect the liver. So for the purpose of this presentation, I'm just going to limit it to viral hepatitis. So with viral hepatitis, it's just a viral infection that causes inflammation to our liver. So if it is left untreated, it can lead to a lot of serious problems in our body. As I said, if we have a healthy liver, it moves on to fatty liver, it becomes fibrotic, it becomes cirrhotic, and eventually it can lead to a cancer. So if you have hepatitis B, hepatitis C, hepatitis A, and it's left untreated, it can lead to serious liver problems. Example, it can lead to scarring. The liver is going to lose all the healthy tissue and is going to be replaced by a fibrotic dark tissue, which will make the liver very, very hard. And eventually it wouldn't perform all the functions that it's supposed to perform. And it will lead to a cancer. So most of the time, people who have viral hepatitis don't really show symptoms. So you might see a lot of people walking around because sometimes it's mostly chronic. It's only a few people who have the acute setting of the disease. It's mostly chronic. So if you are hepatitis B or hepatitis C and you are not showing any symptoms, it's mostly because the viral load, the amount of virus in you is not so high to cause an overt illness. So you will just be walking around with no symptoms, but because the viruses in you are not so much for you to be showing symptoms. The only way you can also get to know you have viral hepatitis is if you get tested. Once you've not tested, you can't really tell whether you have hepatitis or not, because when we are kids, our immunization schedule, it's one of the first vaccines that we get, hepatitis B vaccine. Everyone gets it. It's part of the immunization schedule of our country. But yet still, some people still along the line are able to get hepatitis, even though they've been vaccinated against it. So you have to be checking for, you have to be testing for that. At least if you are working at a place that you think there's a high risk of you contracting that, then you have to be at least checking that once a year, just to rule out the fact that you have hepatitis B or C. And then, as we all know, there's a vaccine that prevents hepatitis A, hepatitis B, and then for hepatitis C, there's no vaccine yet, but there are medications in the system that can be used for the treatment of hepatitis C. So for now, the vaccines are only for hepatitis A and hepatitis B. For hepatitis B, it's part of our routine immunization schedule. So for the types of hepatitis, we have hepatitis A, B, C, D, and E. So these are the main types, but the commonest types that we have in our setting is mostly the hepatitis A, B, and C. Also from the slide, you can see I've indicated hepatitis A and E are mostly gotten through the fecal-oral route. This simply means that they are gotten through contamination of foods we eat or personal contact with people. Once you've used the washroom, you've not washed your hands, you go and touch any food. So it's mostly gotten through food. So if you use the washroom, you basically have to wash your hands properly with soap and water before you touch any food or you touch any surface or you touch any human being, because that's how hepatitis A is gotten or hepatitis E is gotten. But hepatitis B, D, and C are gotten through the parenteral route. So parenteral route means that it's not gotten through the mouth, like eating a particular food or drinking some water that someone who is infected has touched, or coming into close contact with like someone's hands without any the person. Main types, but the commonest types that we have in our setting is mostly the hepatitis A, B, and C. Also, from the slide, you can see I've indicated that can be used for the treatment of hepatitis C. So for now, the vaccines are only for hepatitis A and hepatitis B. For hepatitis B, it's part of our routine immunization schedule. So for the types of hepatitis, we have hepatitis A, B, C, D, and E. So these are the main types, but the commonest types that we have in our setting is mostly the hepatitis A, B, and C. Also from the slide, you can see I've indicated hepatitis A and E are mostly gotten through the fecal-oral route. This simply means that they are gotten through contamination of foods we eat or personal contact with people. Once you've used the washroom, you've not washed your hands, you go and touch any food. So it's mostly gotten through food. So if you use the washroom, you basically have to wash your hands properly with soap and water before you touch any food or you touch any surface or you touch any human being, because that's how hepatitis A is gotten or hepatitis E is gotten. But hepatitis B, D, and C are gotten through the parenteral route. So parenteral route means that it's not gotten through the mouth, like eating a particular food or drinking some water that someone who is infected has touched, or coming into close contact with like someone's hands without any the person washing the hands. So mostly this one is gotten through bodily fluids. So when I say bodily fluids, it's mostly gotten through blood, contact with someone, coming into the person's, so sexual intercourse. Maybe the person is bleeding, you come into contact with the blood through saliva, through semen, through vaginal discharges or mucus, through tears or ear discharge. These are all like bodily fluids, and these viruses can be gotten through that. Let's say someone uses a razor blade, it cuts the person, you also use the razor blade, it cuts you. You could contract hepatitis B or C. Hepatitis D is just a super infection of hepatitis B. So these are some of the things. So I'm going to talk about the commonest hepatitis we have, which is the A, B, and C. So with hepatitis A, it's obviously caused by the hepatitis A virus. It's mostly spread through close to person-to-person contact or by eating or drinking contaminated food, as I mentioned, or drink, as I mentioned earlier on. Usually the trend of the illness, the short term, is mild. And as I mentioned, vaccination is the best way to prevent the infection. Most of the time, people don't even come to the hospital to test for hepatitis A, because obviously, even though it's common in our setting, it's not that common. People are mostly worried about hepatitis B and C, because those are the more serious infections. So ways to prevent or stop the spread of hepatitis A, as I mentioned earlier on, is to thoroughly wash your hands with soap and water after using the washroom. It's very, very important, because that's the only way it can be spread, even though other illnesses can also be spread through that. So you are preventing hepatitis A, plus you're also preventing other illnesses, which will obviously help. Also, you need to wash your hands with soap and water before preparing or eating any kind of food. This is like the standard protocol, like you've been hearing since we were children. Before you eat, wash your hands. Before you prepare any food, wash your hands. After you use the washroom, wash your hands. These are very essential things, because it's not just about washing your hands, but washing it properly with soap and water. So I also indicated on the slide certain foods that people come into contact with. Like for instance, if you use the washroom, you don't wash your hands very well, you touch some of these foods and then a different person drinks it, you could literally contract hepatitis A. So these are some of because it's gotten through food or drink, you can easily contract it. So from the slide, you can see that I've indicated certain foods. So for hepatitis B, it's also one of the, let's say, commonest infections in our country. And the reason being that most of the time people come to the hospital and say, oh, doctor, please, I want to check and see if I have hepatitis B so that I can get the vaccine if I don't have it. So hepatitis B is very common. It's caused by the hepatitis B virus. It's mostly spread through bodily fluids, as I mentioned, blood, saliva, semen, mucus from the like discharge of fluid from the vagina, tears, ear discharge. So these are some of the bodily fluids we have that can aid in the transmission of hepatitis B. It can also be gotten through birth. So if a mother who has hepatitis B gives birth to a child, it can be gotten through the vertical route. So the child can also be infected with hepatitis B. But the good thing is that if the mother is hepatitis B and is delivering the baby would get both the hepatitis B vaccine and then the hepatitis B immunoglobulin, which will all help to fight against the hepatitis B. So it might even end up that the child might not have hepatitis B. That's if the mother goes through antenatal very well. So there's also, the infection can be acute, that's short term, and then it can also be chronic, which is long term. So short term is just acutely, and as I said, acutely, most people have the symptoms and it's very serious. But long term, it's more chronic. People walk around, a lot of hepatitis B in the system, you don't even see them at all because they don't have symptoms. They are walking about normally. And as I said, vaccination is the surest way to prevent the infection. It's solely vaccination. That's the surest way to prevent infection. But there are other ways to stop the spread of hepatitis B. You should not share needles because you don't even know if, or razors, you don't even know if it has cut the person, it has pierced the person, because once it also pierces you, the tendency of you having it is high. You should practice safe sex. So as I mentioned, it can be spread through sexual intercourse. The reason being that there would be semen exchange, there will be vaginal fluid or discharge. All these ones, you can contract it through that. There can be bleeding, which will also cause that. And we should not share razors, toothbrushes, or other personal items because when people brush their teeth, sometimes they bleed. If you use their toothbrush, they've bled. You're also going to use the same toothbrush, you can contract it. And then you should only use clean needles for tattoos. So those who want body piercings and tattoos, you make sure that when you go to these places where they are doing the tattoos and body piercings for you, they are using instruments that are clean and sterilized so that you will not be able to contract that. Because once they've used it for someone, there has been a cut in the skin, person has bled, you can also contract hepatitis B. So with hepatitis C, it's also caused by the hepatitis C virus. Many people with hepatitis C don't look or feel sick. So for them, they might not even know they have the virus because it's mostly chronic. You wouldn't know you have it till it progresses to the later stage for you to know. If you're not getting yourself screened and all that, by the time you realize it's late, you go and do the test at a later part. They'll tell you you have hepatitis C and your liver is almost gone because you develop cirrhosis, it becomes fibrotic, you can have a cancer from hepatitis C, and by that time it's already too late. Treatment will not really help. But if hepatitis C is left untreated, as I mentioned, it can lead to serious liver problems. So chronic liver disease, it will damage the liver, it will cause scarring, eventually it will also cause a cancer. There isn't a vaccination for hepatitis C, but it's cured with oral medications or pills. So there are medications in the system that can be used for the treatment of hepatitis C. So once you do the test and it's positive, you can be put on those medications. They'll also let you do something we call the viral load to know how much of the viruses are in you. Then they'll put you on medications to treat it. So the other ways to also stop is to stop sharing needles, practice safe sex, not sharing razors and toothbrushes. And then when you go for body piercings and tattoos, you make sure they are using sterilized and clean instruments for that. So with viral hepatitis, I just mentioned some of the symptoms you should take notice of. So if you realize your urine is dark or your stool is pale or clay colored, sometimes also dark, you should be worried because your urine shouldn't be dark. Of course, it's not only viral hepatitis that can cause dark urine. There are other causes of dark urine, but you should come to the hospital. I'm sure as part of the investigation panel, they will definitely screen you for the viral hepatitis to know which of them is causing that, or if any other disease is causing that. Also, as I mentioned, the hepatitis A virus is gotten through the fecal-oral route. So it can cause symptoms like diarrhea because it's mostly gotten through food. So once you take it in, you'll be having diarrhea. So not every diarrhea is mostly, should I say, as a result of bacterial infection. It could also be caused by hepatitis A. You feel excessively tired. You can have a fever. You come with complaints of joint pains, loss of appetite. You even feel nauseous. You come with abdominal pain because the liver is, as I mentioned in the first slide, the liver is located at the right upper part of our body below the rib. Sometimes people come and complain, oh, I feel pain over there. It could be your liver. It could be, even though there are other organs there, the liver could be the cause of that. It can also cause vomiting. There's also something which is very prominent that most of the time, even your friend might see your eyes and say, hey, why are your eyes so yellow? Means you are developing jaundice. It could be a sign of your liver failing. So, or it could be that you have an infection of the liver. So once you notice that, you rush to the hospital for the necessary investigations to be done. Can pass by Sakumono community and we'll definitely look into it for you. So there's a picture of someone who has jaundice. So once you wake up, you look into the mirror, you realize that your eyes are yellow. It's not normal. Your eyes are supposed to be white. So if it's yellow, come to the hospital. The necessary investigations will be run for you, and then we'll figure out the cause. So as I mentioned, the liver goes through a lot of stages. It's a healthy liver, fatty liver. The liver is losing its healthy tissue. It's being replaced gradually with a fibrotic tissue, which is very hard. The fibrotic tissue also goes on for a very long time. It's building up or it's forming for a very long time. The liver eventually loses all the healthy tissue and it becomes solely fibrotic and very hardened. Just like in the picture I've shown over here, it becomes, so there will be like, it looks like there will be scarring. The tissues become very hard and the liver becomes, also the liver decreases in size a bit and the surface of the liver becomes very, very rough. So when you come to the hospital and you realize that we are doing an examination of your abdomen and we palpate that part, even we can feel the liver being rough whilst we palpate. That one will give us an idea. So what's happening? Then we'll now let you go and do the scan. The scan will also confirm that. Then for liver cirrhosis, there isn't really a treatment for liver cirrhosis, unless maybe you are going in for a liver transplant. But the only thing that can be done for liver cirrhosis is you also have to still modify your lifestyle modifications. It's more symptomatic treatment. Whatever symptoms you have, we try and treat it. And you make sure that it doesn't progress to the level of chronic liver failure or liver cancer. Once you do your lifestyle modifications, of course, the liver is not going to reverse because this is an irreversible process. It's not going to reverse to the way the liver was, but at least it's not also going to progress to the stage where there's chronic liver disease or there's liver cancer. And as a result of chronic hepatitis going on for long, for instance, you have hepatitis B, you've not screened yourself for a very long time, or you have hepatitis B, you've come to the hospital, you've been screened, but maybe the viral load was high, they placed you on medications, you lost to follow up, you were not coming to the hospital. You realize that as time goes on, the virus is going to multiply in your blood or in your body. It's going to go ahead and still affect the liver. It will lead to the cirrhosis and eventually it will lead to a chronic liver failure. The only thing that can be done to salvage the liver is to do a liver transplant, which of course in our setting, you will not get it. So I just put on some symptoms of chronic liver disease on the slide. So as I mentioned, the liver becomes big. There can be accumulation of fluid. You can see this abdomen looks very big on the first picture. There will be accumulation of fluid. the liver becomes very hardened and smallish. You can see that on your stomach, you see this dilated. We have veins on our abdomen. You realize that the veins will become very prominent around the abdomen. So you'll be seeing them. Also, if you're a male, because of as I mentioned, obesity being a cause, there will be a lot of production of estrogen, which is the hormone for females, in you. It will cause you to have something we call gynecomastia. So your breasts become like big, like that of a female. And as I mentioned, you have the jaundice. The blood vessels under the skin will become so dilated that you can see them in your palms. That's where we have the palmar erythema. And then on the same abdomen, you'd also be seeing some dilated arteries on the abdomen. That's the spider nervi. And then there'll be easily bruising. Every small thing you do, you realize that even if your hand hits a table or hits a chair, you easily get bruised. It's also a symptom of chronic liver disease. It shows because the clotting factors are produced in the liver. Because the liver is damaged, the clotting factors also reduce. And the clotting factors are mostly what are responsible for our blood to clot once you even like bleed. You realize that you'll be having a bruise which will be bleeding and it wouldn't be able to stop. Also, your fingernails change. As I mentioned, the liver is responsible for the synthesis or production of proteins. Proteins are for body building. It helps our nails to grow, our hair to grow, and all that. So if your protein levels are low, you notice that your nails also develop this color from the picture. It becomes whitish, even it will not be smooth. You realize that it will not be growing as you expect it to, and then it will change color because there's a substance or a subunit of protein that's responsible for that, which is the albumin, is also going to be low. Then metabolism. So the motor function is also like deranged habits. What's your proof? You have to get tested. That's the only way you can know you have hepatitis. So on the slide. So as I mentioned, the liver becomes big. There can be accumulation of fluid. You can see this abdomen looks very big on the first picture. There will be accumulation of fluid. The liver becomes very hardened and smallish. You can see that on your stomach, you see this dilated. We have veins on our abdomen. You realize that the veins will become very prominent around the abdomen. So you'll be seeing them. Also, if you're a male, because of as I mentioned, obesity being a cause, there will be a lot of production of estrogen, which is the hormone for females, in you. It will cause you to have something we call gynecomastia. So your breasts become like big, like that of a female. And as I mentioned, you have the jaundice. The blood vessels under the skin will become so dilated that you can see them in your palms. That's where we have the palmar erythema. And then on the same abdomen, you'd also be seeing some dilated arteries on the abdomen. That's the spider nervi. And then there'll be easily bruising. Every small thing you do, you realize that even if your hand hits a table or hits a chair, you easily get bruised. It's also a symptom of chronic liver disease. It shows because the clotting factors are produced in the liver. Because the liver is damaged, the clotting factors also reduce. And the clotting factors are mostly what are responsible for our blood to clot once you even like bleed. You realize that you'll be having a bruise which will be bleeding and it wouldn't be able to stop. Also, your fingernails change. As I mentioned, the liver is responsible for the synthesis or production of proteins. Proteins are for body building. It helps our nails to grow, our hair to grow, and all that. So if your protein levels are low, you notice that your nails also develop this color from the picture. It becomes whitish, even it will not be smooth. You realize that it will not be growing as you expect it to, and then it will change color because there's a substance or a subunit of protein that's responsible for that, which is the albumin, is also going to be low. Then there's something we also call finger clubbing. So with the finger clubbing, So with the finger clubbing, that one, you realize that the nails will assume a very abnormal shape. This is because as I mentioned, the protein levels are supposed to help with that, but this is the case, you're in deficit. Also, you realize that you'll be having something we call hysteresis. When you see from the picture, you can see the person has stretched out a hand. You realize that when you stretch out your hand, it's not supposed to flap or move. But with people who have chronic liver disease, once they put their hand in the air and even you put a paper on their hands, you realize that the paper will just be shaking up and down because they have something. This is due to a faulty metabolism. So the motor function is also like deranged. So that's what usually happens. And then those who have chronic liver disease, because of the buildup of waste substances in them and all that, they have something we call fetal hepatitis. So with that one, there's a characteristic odor from their mouth because things that are supposed to leave your system are not leaving. So you end up having that odor in your mouth, which is also not pleasant. So what's the next or the advisable thing to do? You have to get screened and tested. That's the only way you can know you have hepatitis. You can't just be at home and say, oh, I know I don't have it. What's your proof? You have to get tested. That's the only way you can know you have hepatitis. So it is recommended that adults get screened for hepatitis at least once in their lifetime through a blood test. So once in their lifetime through a blood, that's the source was from the Center of Disease Control. So the question is, someone will say, okay, so I've tested it once, I'm not going to test again. But you're forgetting that as you move further in life, things happen. You come across certain things and you could easily contract it along the line. So even if they are saying you should get tested at least once in your lifetime, it's just like the bare minimum. You have to get tested. At least you can be doing that once a year to know you're fine. Then even if you get tested and it's negative, you can just come in for the vaccinations. They have a schedule for it. Then you come in for it. Then you know you're at least covered. Even if you come into contact with something, you know that you've been vaccinated against it, so you're not going to contract it. Also, there are certain people in our society who have to be tested more often. These are pregnant women during each pregnancy. Remember, I mentioned that it can be contracted or the baby can contract it through birth. So during pregnancy, during the antenatal, we mostly screen women to prevent that from happening. And if we screen and the woman is positive, we go ahead and then we do the hepatitis B profile and then hepatitis B viral load, because we do that to rule out to know the amount of viruses in you, whether you have to be put on medications and whether the viruses that are in you, they are not acute replicating, or it's just a chronic thing. So once we know it's just a chronic thing and the viruses are not in you, we just monitor you till the end of the pregnancy. Once you deliver, we give the baby the hepatitis B vaccine and immunoglobulin. Then the baby is also good to go. So infants born to pregnant women with hepatitis B infection. So once the pregnant woman is being confirmed she's hepatitis B and has delivered, even though we've given the baby the hepatitis B vaccine and immunoglobulin, there has to still be follow-up with the baby. So as time goes on, they have to still be at least screening them for hepatitis B to make sure they don't have it, so that it will not, if they do have it, it will not progress to something else. Then if you're in an environment where there are risks for you contracting hepatitis B or hepatitis C, then you should get yourself screened more often. So you're in an environment that you think there's exposure to bodily fluids. Like for instance, in my line of profession, I come into contact with a lot of bodily fluids. I have to be screening myself for hepatitis B almost every year, because at the hospital, I come into contact with a lot of fluids. I come into contact with a lot of people. So I have to be screening myself to make sure I'm not also going to contract it. So for hepatitis B, it's mostly about so for our liver, it's mostly about preventive measures that we have to put in place. That's the only way our liver can function the way it's supposed to function, so that we can go about our activities the way we want to go about it without hindering any hindrance. So as I mentioned, some of the liver-friendly diet tips is balanced diet. So if you take in more fruits, more veggies, whole grains, and then taking foods that are rich in fiber, all these ones help with our liver function because they contain essential nutrients that will help the liver to function properly. than some of these other unhealthy foods like the junk foods that we take in. Also, you should try to take in protein sources that are not rich in like fats. For instance, if you are eating the chicken, maybe take off the skin, or you're going for lean poultry, or you're going for fish. You can substitute your proteins with beans. You can also make sure that you take in some of these dairy products, maybe like unskimmed milk, things that will not contain a lot of fat. So when you're buying these things, you have to take that into consideration. And then you focus more on the fiber, which is the whole grains, legumes. So all these things aid in digestion and aid in the proper functioning of the liver, because they'll obviously also boost your immune system. Then obviously you have to stay very, very, very hydrated. Staying hydrated is not only for the liver, it actually helps with the kidneys. So, but I think later I'll pose a question to you. Maybe how many like glasses of water, or how much water do you think you have to drink in a day? It's also very, very important, because some people will say, "Oh, I really take in a lot of water." How much water do you take in a day? The person will say, "I take 2 of the small Voltic bottles a day." That's not enough. You have to be drinking more than that, at least 6 of those bottles. So in a day, you're supposed to be drinking at least 3 liters of water. That's the only way your kidneys and your liver will function properly. And then, as I mentioned, obesity is the #1 cause. High cholesterol levels, another cause of fatty liver. So you have to perform some activity. You shouldn't live a sedentary lifestyle. Brisk walking, walking for short distances to get stuff instead of using your car, taking walks in the evening, going for jogging, doing some light exercises at home. All these things help to maintain your weight, which is very, very important. And then, of course, in this world, everyone gets stressed from work, from personal issues and all that. So you also have to, because that one also helps. Once your mental health is affected, it affects everything about you. So you also have to manage stress very well. If you need to take a break, take a break. If you have to take like 2 days or 3 days to manage your stress, you have to do that, because it's obviously going to also help not just your liver, but your general well-being. So these are some of the liver-friendly diet tips that you can take into consideration. And you can see from the slide on the right, you can see there are some harmful products. And so as I mentioned, the smoking is not good. Taking in the junk food is not good. Obesity, you have to make sure at least you exercise to keep your weight in check. And then sedentary lifestyle, you try and avoid it as much as possible. And then the alcohol, you also try and limit it, or if possible, just stop it, because it's obviously going to destroy your liver cells. And then the protective things are on the right, where you can go through and you basically be fine. So in conclusion, what I want to say is the liver is one of the hardest working organs in our body. It's doing the work for you, but maybe you don't know it's doing the work for you. It's a very silent worker. It filters all the waste substances and toxins from our bodies. It aids in digestion. It stores energy levels for us. Our glucose is mostly produced or sensitized from the liver, which helps to play a vital role for us to even get up and gain energy to go to work and perform our activities. So it plays a vital role in our overall wellness, which is very essential. So it's all about making certain simple life choices to make the liver function the way it's supposed to function. You're supposed to maintain a balanced diet. I spoke about the diet. Stay hydrated, avoid harmful substances, exercise regularly, and all these things will go a very, very long way to protect your liver and prevent certain illnesses from happening. You should also get yourself screened and tested for hepatitis, so that if you are negative and you've not gotten the vaccine, you have to come around and get the vaccine and come to Sakumono community. We'll obviously have you even do a liver function test. We screen you for the hepatitis, and if there's a need to get the vaccination, we'll make sure you get it. And You should also note that liver wellness isn't complicated. As I said, it's about making simple life choices or lifestyle choices. You can start small. You don't have to start big. It's a consistent and gradual thing. So little drops, they usually say, make a mighty ocean. So it should be small, consistent, and you become a healthier you and a stronger you. So you just have to take care of your liver and it will take care of you for life. Thank you very much. And if there are any questions, I'll be very happy to answer them. Thank you.
Thank you, Dr. Mashood, for the insightful presentation. And I'll read some few questions from the chat box.
Okay.
Hello, Doc.
Yes,
Hello,
please.
Doc. What should one do when they are required to take lifelong medication for survival, but the medication has significant side effects?
Okay, so that's a very good question. So the thing is, lifelong medications, they are always substitutes. So for instance, if you're being put on, let's say you're hypertensive, you're being put on an antihypertensive medication, and that medication, the side effects of that medication is it causes liver issues. Then your doctor will definitely, there are various classes of drugs that can treat various conditions. With that one, they'll put you on a medication that will not affect the liver. So sometimes when you're prescribing medications, that's why when people even come to the hospital in the first place, they make them run certain labs. You do your liver function, you do your kidney function, and then you do a full blood count and all that. It makes us know what medication, if you should come and your kidney is not even functioning well, there are some medications that can be prescribed for you. If you come and your liver is not functioning well, there are some medications that would also not be prescribed for you. So we take into consideration medications that you are given based on some of these parameters. Then we'll put you on the medications that are lifelong, that we know are not going to harm the liver. I hope I have answered your question. Hello.
Okay, and yes, please. She's given us a thumbs up, which means that you've answered her question. And also, what are the early
Okay.
warning signs of liver diseases that we should watch out for?
Okay, so for early warning signs of liver disease, as I mentioned, the number one warning sign of liver disease is the yellowing of the eyes. Once you notice your eyes are getting yellowish, then you should get yourself screened because it could be the liver. And most of the time, it's liver pathologies or liver conditions that cause you to have the yellowing of the eyes. And as I mentioned, sometimes with liver conditions, people go a lot of years without having symptoms. So until you get screened, you don't know. But the number one early warning sign of liver disease is the yellowing of the eyes. Once you notice that, you come to the hospital. Once you are even also complaining, sometimes you complain of an upper quadrant pain. The pain is located at the upper part of your abdomen on the right. It could also be the liver. So you just have to pass by for the necessary investigations to be done. Of course, there are some people who have yellowing of the eyes and it's not as a result of the liver. Especially there are some conditions like people who have sickle cell disease and people who have G6PD deficiency and all that. They can also have yellowing of the eyes, but for them, there's an underlying condition. But for you, the healthy person who is not sickle cell, and you notice that there's yellowing of the eyes, you basically have to visit the hospital. That would be like the one of the first signs you see.
Okay, thank you, Doc. Frederick, kindly ask your question.
Thank you, Dennis. Doc, good morning.
Yes, please. Good morning.
Please, in your presentation, you mentioned that hepatitis A, B, and C, the viral one stays in the saliva.
Yeah.
And
no, just
so
hepatitis B and C. They are the ones who are
just hepatitis B and C.
B and C. They are actually contracted through bodily fluids. Yeah.
Yes. And the virus can stay in saliva as well.
Yes, please.
So I wanted to confirm with you, is it transferable through kiss? What's the percentage?
Yes. It's
transferring such virus to case, and because if you read other sources too, they say
yeah.
it can't be transferred through kisses.
They said it
That is
can't be
one of
transferred.
it can't be transferred
It
through
can.
kisses.
It can't.
Okay. Yes, can't.
It can't. Okay, so
Yeah.
when I meant bodily fluids, so for instance, you see hepatitis B and hepatitis C, they are not gotten through the, should I say, enteral route, which is like through the mouth. You understand? But when I talk about bodily fluids, for instance, let's say someone has saliva in the mouth, or you're kissing the person with saliva, and let's say you have like a sore in your mouth. You understand? Once you have a sore in your mouth and the saliva from that person to you, even though it's passing through the enteral route, because there's a break in your skin, you could contract it. You get it? Because there's a wound and it can be gotten through that. So that's where the bodily fluids come in. You get it? It's not like you are swallowing the saliva, so you would have it. When you swallow the saliva, it's going through the enteral route. It could happen, but the tendency of it happening is not so high. Like if you have like, let's say an ulcer or a bruise in the mouth, or sometimes people come in and say my mouth, like inside my mouth is sore and all that. Please, you get it?
Yes, please. I understand. And
Yeah.
thank you very much. My follow-up question is, sometimes when you go to the hospital after checks, doctors do say you have a dormant, if it's hepatitis B or C, they said the virals are dormant. Now, with those who have this dormancy in terms of the virus, is it possible to experience weakness, and how often does this weakness occur in the body of such a person, and what could be the causes?
Okay, so you see, the thing is that with viruses, it's as a result of a decreased immunity, because ideally most viruses, that's why we don't have medications for most viruses. It's supposed to be self-resolving. Most viruses are self-resolving. So when you come into the hospital, let's say you come to the hospital, you have hepatitis B. You are going to do a test called hepatitis B profile and hepatitis B viral load. With hepatitis B profile, you want to know whether the infection is acute or replicating, or the infection is chronic and non-replicating. And then the viral load, that one is going to give us an idea of whether the hepatitis B virus in you, how like, is it a lot? Because if it's a lot, if it's more than 20,000, you have to be put on medications for the hepatitis B infection. But if it is even less, and we do the hepatitis B profile and it's not showing that it's an acute replicating infection, but it's rather a chronic non-replicating infection, then that one, it's more like lifestyle management. You don't have to be put on medications. You have to be doing things that will help your immune system. Sometimes patients come to the hospital, we even put them on hepatoprotectors. It's not like these hepatoprotectors are treating the hepatitis B you have, they are just to protect the liver from like getting worse or moving on to a different like stage. So when someone comes in with like the weakness, then it's possible maybe the disease is progressing, even though you do the test and then they'll probably say it's dormant, or your immune system is that weak. So you need something that will help boost your immune system to give you the sort of strength you need. Please, I hope I answered your question.
Yes, please, you did. You did.
Okay.
Thank you very much. Lastly, Doc, is it through all that you've said, is dizziness a possibility to occur in with such a person?
Oh, dizziness. Yes. Dizziness is very likely to occur. So you see, with hepatitis B, some of the symptoms can be non-specific. So like people will come in with, the symptoms can be non-specific. And dizziness is a symptom of most conditions. It's not like specific for a particular condition. So dizziness, the patient can also present with dizziness. But you see, with just the dizziness, you also have to, like, as doctors, we have to also probe in further to know if there are other symptoms, maybe examine properly. And because sometimes, you see, when a patient comes to you at the hospital, it's not only about go and do these labs and come. Your physical examination and a very detailed history gives you an idea of what you're even expecting before the patient even goes to the lab. So we already have like some differentials in our head. the lab just comes to buttress like what we are thinking. Did you get it?
I do. Thank you so much, Doc. Thank you.
You're welcome.
Okay, Doc. So
Yeah, I can hear you.
Okay, when should I be screened for hepatitis B? And are there any specific foods or diets that help support liver function?
Oh yes, so I mentioned that. So you can get screened at any time. There isn't any age limit to getting screened for hepatitis B. You can even walk in today and get screened. Once you come in and you express the point that you want to get screened for hepatitis B, you can be screened. And if you get screened and it's negative and you want to be vaccinated against it, why not? That will even be better. And then, as I mentioned, with the diet, we have, as I mentioned, the causes of most of these fatty liver and other things, mostly what we eat. So once you're taking in fruits, you're taking in vegetables, you're taking in lean protein, fish, you're taking in oil, beans, and less of the junk foods. So these are things that will help protect your liver because, of course, fruits and vegetables have nutrients, micronutrients and macronutrients in them that help to like protect the body's immune system, eventually like protecting the liver. So you just have to take in foods that are whole grains, the green leafy vegetables, fruits, stay hydrated, exercising. If you are someone who drinks a lot of alcohol, you try and then minimize it or stop it. All these things like play a very big role. Yeah.
Abigail, please ask your question.
Thank you. Thank you, Doc, for that
You're
great
welcome.
presentation. So
You're welcome.
I just want to find out.
Yes,
I
please.
think about between, I think 15, 20 years, we got screened and then we're given the shot for hepatitis
please.
B. And I think we got another after
Yes.
2-3 years, we got the booster. Would you
Yes,
advise that? Would you advise that we get screened and tested, and if possible, have the vaccination?
Oh,
And
yes,
my
yes,
second
please. So
question
it's been okay.
okay.
When you're done.
And my second question is the hepatitis B vaccination.
Yeah.
Is it potent for the other types of hepatitis, or there are different vaccination for them?
Okay. Okay, sure. So with your first question, once you've gotten the hepatitis B vaccine and then you've gotten the booster, so ideally after 10 years, you're supposed to come for another booster. Ideally. So if it's been up to 10 years, you just pass by again, we get you screened. If it's negative, you get your booster. That's basically it. And then for the hepatitis B vaccine, as I mentioned, it's only hepatitis A and hepatitis B that have vaccines. But you can't use hepatitis A vaccine for hepatitis B. They are all separate vaccines. So if you are giving a vaccination for hepatitis B, it's solely for hepatitis B. If you are giving hepatitis B vaccine if you are giving a vaccine for hepatitis A, it's solely for hepatitis A. You can't be giving hepatitis A vaccine and it's treating hepatitis B. So they are solely for their various, like their causative organisms that cause it. So we are tackling those causative organisms, not like all the hepatitis B viruses. Did you get it?
Okay, thank you. And my last question was, are there any side effects of the vaccination?
Oh, yeah. So with every vaccination, as we all know, side effects do happen, but the side effect is not like they are going to obviously feel weak. Some people have like fever after getting a shot. Most of the time, that's the commonly reported, should I say, side effects of the vaccination. People complain that, oh, I feel feverish, I have chills. It's common after some vaccinations. I'm sure when we all had the COVID vaccine, I don't know if you experienced that, but after they gave you the shot, when you go home, you kind of like develop a fever, or you have chills, or another common effect of the administration of the shot is you feel pain at the site of the injection. That's basically it. But like with obvious infections, unless maybe the ingredients or something that was used for the vaccine, you are actually allergic to it and you get injected with it and then you start developing some allergic reaction. But most of the time it's far-fetched. It's very far-fetched. So I wouldn't say there are a lot of people have had hepatitis B vaccine shots and have not reacted to it. Most of the complaints that people come with, or after I had a shot, I felt a little bit of fever when I went home. If you take paracetamol, it basically goes away. It's short-lived. So there aren't really side effects. Yeah. Yes, I hope you got it.
Yes, and thank you.
You're welcome.
Audrey, please ask your question.
Thank you. I have two questions. So one
Okay.
is, Doc, I heard you saying that you have to take a lot of vegetables. I've heard that depending on your blood group, you can't take certain things. So for instance, if you are O positive, you're not supposed to take cabbage. I don't know how true that is. So if you could touch on that or clarify that, as
Okay.
part of like healthy living concerning the liver. And then also my second question is, if you've never been vaccinated against hepatitis, any of the hepatitis, but like often you show symptoms, can you still come for a vaccination or how do you go about it?
Okay, that's great.
Thank you.
So about the first question, right? You asking about people's blood group and the sort of food they are not supposed. It's not research proven, right? So I think it's more for what works for you. There are some people when they take in cabbage, they generally don't feel fine. Not like limited to I'm blood group O. When I take cabbage, I don't feel fine, or I'm blood group something. We all know ourselves. We know the foods that we eat that we don't feel fine. I can be blood group O. They've told me that if I eat cabbage, it's not going to work. If I eat cabbage, nothing is going to be wrong with me. So it's solely individual based. It's solely specific. It's not research proven. You can eat whatever fruits you want to eat, whatever vegetables you want to eat, but you should know yourself and you know whatever fruits you eat, how you react to them. Then you desist from it. But with respect to like blood group and blood group this, I don't take this. It's not really like and then also when you're showing signs of hepatitis. So the thing is that if you are showing signs, you have to come, we have to test you. When we test you and then it is positive, then we know it is truly hepatitis. But when you come, as I said, unless maybe some of the symptoms can be very non-specific. But if you come in and you're having symptoms of that, obviously we are going to like test you for that. And when we test you for that and we notice that it's positive, then we know the next line of action. But if we test you in hepatitis B, C, all these ones are negative, and you're having those symptoms, then it could likely be the cause of something else, which would also like investigate further. And you definitely have the vaccine if you want it, because obviously the tests are negative. So why not vaccinate you? Get it? Yeah. So please, I hope I answered your question.
Yes, please. Thank you.
Okay. You're welcome.
Doreen. Doreen, please ask your question. Okay, Doc. So, if you've ever had a liver laceration, does it lower the function of your kidney?
Okay. So if you've had a liver laceration, the liver regenerates, especially if you've had a laceration. So of course, maybe at the time where the liver laceration has happened, of course, because there's been a traumatic event to the liver, it will obviously cause your liver function to decrease. But with time, it should heal, because the liver, you can't really like go and say you're sewing the liver because of the way the liver, the consistency and texture of the liver. You get it? So it depends on the extent of the liver laceration and the clinical symptoms. So if it's a very an extensive liver laceration that can like the liver is like torn or completely torn, then that one a liver transplant. But if it's a laceration that's not like so deep, then that one it should heal. You will just be monitored. And your liver function eventually, as the years go by, so you'll be doing liver function tests to see if the liver function is even like reducing or not. But it depends on the extent of the laceration. It solely depends on the extent.
Okay, thank you, Joe. Please, do
You're
we have
welcome.
any more questions to ask? So I'll now call on Michael to give us the closing remarks.
So before Michael comes in, I also wanted to draw your attention to something. You guys should pass by the hospital and get screened and tested, okay? So that if there's a need for you to have the vaccination, you can have it. Sakumono community is always open to you guys. So pass by and get tested. That's if you've not tested recently and you've not been vaccinated. Our doors are open. You can also pass by and have your liver function test to be able to like know the state of your liver too. If possible, do ultrasounds to also know the state of your liver. So pass by. Our doors are opened. Thank you.
Doc, a quick one. Is the testing free?
The testing is not free, obviously. It's not free. Yeah.
I thought you were doing a promo.
Oh, no, it's not a promo. Yes, please. Thank you.
Michael, over